Today we're going to talk about flu prevention, and when to seek emergency medical care for a loved one who's sick with the flu. Seasonal and H1N1 flu symptoms are similar. The flu tends to hit you like a ton of bricks. One minute you feel great, and the next minute you feel horrible with a fever, headache, dry cough, sore throat, and body aches, just to name a few symptoms. The good news is that most people will recover on their own by staying home, resting, and drinking plenty of fluids. To help with the fever and body aches, you can take one of these medications, but avoid aspirin because it doesn't work well with a fever. And remember, children should never take aspirin for the flu. If you are fever-free for 24 hours without using medication, I have good news for you. You're on the road to recovery. For those who might experience complications from the flu, your doctor may prescribe antivirals. At the first sign of flu, don't go to your doctor for antibiotics. Antibiotics are only effective on bacterial infections and not the flu. So, when should you seek emergency medical care? For a child, the symptoms you need to be concerned with are rapid or difficulty breathing, purple or bluish skin, if they're unable to drink enough liquids, fever with skin rash, irritability or not wanting to be held, if they're unable to wake up or respond, or if symptoms improve, then worsen with a fever and cough. For adults, the symptoms you need to be concerned with are difficulty breathing or shortness of breath, pain or pressure in the chest or stomach, sudden dizziness, confusion, and severe or ongoing vomiting. If you or a loved one are sick with one or more of these symptoms, you should seek emergency medical care immediately. Remember, preventing the flu begins with you. There are several things you can do to stay healthy. Wash your hands often for at least 20 seconds, the time it takes to sing Happy Birthday twice. Cover your cough or sneeze with a tissue or use the Dracula cough. Avoid touching your eyes, nose, or mouth. Avoid close contact with people who are sick. And if you are sick, don't go to work or school, but stay home and rest. You can return to work or school 24 hours after your fever ends. It's important to follow all of these tips, but remember the best protection against the flu is to get vaccinated. So get your seasonal and H1N1 flu shots today. On behalf of the Department of Public Health, thank you for your attention. See you next time.